Now to the coronavirus pandemic, the country hit another new record high, reporting more than 127,000 new cases in just the past 24 hours. That brings the total to over 9.8 million cases since the pandemic started. That's according to new numbers from Johns Hopkins. The U.S. also reporting more than 1,000 new deaths. And here tonight to talk more about the COVID-19 pandemic is Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins Center for Health Security. He's also served on the National Collegiate Athletic Association, Coronavirus Advisory Board, and also University of Pittsburgh Medical School professor. So, Dr. Adalja, we thank you so much for joining us tonight.
Thank you for having me.
Now, doctor, we know throughout the country yesterday, people came outside, they were congregating as they celebrated or protested the results of the election. We just showed our viewers some of that footage. How do you think this could affect our COVID numbers here in the U.S.?
The COVID numbers are going to go up irrespective of what we're doing now because we're seeing this big trajectory. I do think that when we think about the celebrations that happened after the election announcement, you have to worry because social distancing clearly wasn't being observed in many of those celebrations. Some of the people wearing masks, but it wasn't 100%. So we likely will see some transmission events just based on how much this virus is circulating in the community. Hopefully it will be something that can be manageable, but we do have to prepare for cases that result from those celebrations.
All right, so you say that the numbers are going to go up. How would you characterize how the U.S. is battling the virus right now, especially now that we're in the middle of the fall season?
It's really been a very compromised response to this virus. We have not seen any kind of effective control measures. We've basically seen this virus slip in and out of control since the beginning, since January. And this is something that I think that didn't have to be this way. We could have set up systems that would have been able to handle cases, that would have been able to constitute a test, trace, and isolate type of protocol, which we've never been able to really do. So I do think that when you look at the response so far, it hasn't been something that we should be proud of. It's really been something that's the opposite of how we'd want to handle an infectious disease emergency.
And I really feel like we can kind of maybe already know what your answer to this would be, but if the country's COVID response doesn't change, if it stays the same, what are your predictions for the winter and even beyond?
We know this virus spreads better when it gets colder and also when people need to be indoors because they can't do things outside. What will happen if we don't get control of this virus is you're seeing more hospitals get into problems. We're already hearing about hospitals in North Dakota, South Dakota, Utah, Wyoming, El Paso, Texas getting into trouble. That will be the pattern if we don't get these chains of transmission stopped. So we do need to really hit pause here and have a reset and really realize the fact that we're in a pandemic and we have to just make some risk calculations that are a lot better than what we've been doing so far. And that will go a long way to decreasing the amount of spread. This has to be coupled also to common sense interventions like wearing a face covering, washing your hands a lot, trying not to be in congregated or crowded settings. But this is going to be very challenging, and hopefully, I think with the new administration, there is an effort to make this a priority, so we hopefully will see something improve over time, but it is going to be a long haul.
Well, we know, doctor, that Texas is getting close to becoming the first state now to surpass 1 million COVID cases. So can you just talk about how this type of uptick really strains hospital capacity?
Well, when you see cases increase, they eventually set off chains of transmission that land on vulnerable populations. Those populations then end up requiring hospital-level care, and that has to be the key. Remember, when we talked about flattening the curve, it was about keeping it below hospital capacity. And what you see in Texas, for example, is several counties, Harris County, Dallas County, El Paso County, all three of those driving the cases that are occurring there. And in El Paso, for example, they already have mobile morgues because of the deaths increasing there. They're using military medical resources to augment their hospital capacity. This isn't something that we wanted to happen. And that's why a place like Texas, where the percent positivity is in the double digits of the tests that are coming back, they need to get control of this. And there already are some very targeted public health interventions going on in El Paso in terms of gatherings, in terms of non-essential businesses. We don't want to be in that position where we have to issue those types of measures. What we want to do is get people to actually realize that this is a pandemic and the actions that they take go a long way into keeping cases to a manageable level.
All right, Dr. Adalja, before we let you go, I wanted to ask you, what was your reaction last night when President-elect Biden basically saying his first priority is going to be battling the pandemic, battling the COVID here in the U.S.?
many of us in this pandemic field have been talking about the fact that this is an underappreciated part of government action, and that we've had a hard time trying to sell people on how important it is to prepare for pandemic. So it was heartening to see that this is a centerpiece of the president-elect's new plan. And I do think that the plan that's been articulated so far on his website and in the speeches is something that many of us in the field have been cheering. And hopefully this will be this will be something that translates into us getting control of this virus and being able to move on with our lives, as well as prepare for the next pandemic and increase the resiliency of this country to the inevitable appearance of another virus that causes a similar type of outbreak.
All right, I think you might be breaking out right now or breaking up with us, but Dr. Amesh Adalja, we appreciate your expertise. Thank you so much for joining us tonight.
Thanks for having me.